This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. The CDC says nearly 4 out of 10 adolescents in the U.S. have yet to receive one dose of the COVID-19 vaccine. In most states, Connecticut included, minors need parental consent before receiving a vaccine. But in a public health crisis, should adolescents be able to make their own decision about the vaccine? You can join us, 888-720-9677. That's 888-720-WNPR. Or find us on Facebook and Twitter at Where We Live. Today we hear from researchers and a local pediatrician about the vaccine debate. And later, how are teens in Connecticut talking about the COVID-19 vaccine with their peers? We learn about a program at Stamford Health. Joining us first are two researchers who've published a paper in the New England Journal of Medicine titled Adolescents, Parents, and COVID-19 Vaccination, Who Should Decide? On Zoom with us, Dr. Holly Taylor, member of the faculty at the Department of Bioethics at the Clinical Center at the National Institutes of Health. Holly, welcome to our show.
Thank you.
Also with us is Susanna McGrew, who's a fellow in the NIH's Department of Bioethics. Susanna, welcome to Where We Live.
Thank you.
So, Holly, I'll start with you. Before we talk about the COVID-19 vaccine specifically, remind us what decisions teens can make without parental consent.
Yeah, sure. Happy to share that. One point to make is that this is usually dictated by individual states. So I can tell you generally what adolescents are allowed to provide consent for, and in some cases the age at which it can happen or the different options that adolescents have. But generally, adolescents have the opportunity to self-consent to treatment for substance use, mental health disorders, sexually transmitted diseases, and in some cases contraception and abortion. And then in a few cases, adolescents are also able to consent for prevention when there is a public health crisis or communicable disease that is reportable, but that's the minority of states.
I know here in Connecticut, because of data shared with us from the Centers for Child Advocacy in Connecticut, teens can consent to STI diagnosis and treatment, also HIV prevention, and anything related to reproductive health, mental health treatment, but not medication. So I thought that was good to clarify. When we talk about some of these exceptions that do exist, I'm wondering, Holly, when did this come about where adolescents were able to make decisions in some areas of health in their lives?
Well, from an ethical perspective, right, on one hand, you have an adolescent who is in a position of a diagnosis, perhaps, or a situation that has clear personal implications, and in some case, public health implications. And because they may have a concern about disclosing this information to their parents, many states have allowed for these exceptions. The alternative being, right, that those adolescents may choose not to seek treatment, and that could have dire consequences for them. So in most cases, it's for their individual benefit. And then in a couple cases, it's also related to the public's health, right? So with a sexually transmitted infection, for example, you want to encourage the adolescent to get diagnosed and treated so that he or she does not spread that infection beyond, once they're cured, they can no longer spread it.
So let's talk about vaccinations. Susanna, remind us the context of why parents legally have control over vaccinations of their adolescent children.
Well, parents legally have control over a lot of decisions that their children make. So pretty much children when they're young don't decide where they're going to go to school, what religion they're going to be brought up in, what they're going to eat for dinner for the most part. So parents kind of, as a general right, make decisions for their children for all sorts of things. And medical decisions are just one of those categories of decisions that parents generally have the right to make on behalf of their children. That's largely because young people aren't considered competent enough to make responsible decisions for themselves. and their parents are considered to be acting in their children's best interests. The few examples that Holly just mentioned and that you mentioned earlier about mental health, substance abuse, STIs, things like that, those are examples of cases where adolescents and parents might not see eye to eye, or adolescents might have trouble bringing up those topics with their parents, and it might be in the adolescent's best interests to receive treatment without necessarily going through a parents in the first place.
Holly, in your research, this paper, again, that was published, when we think about the conversations that teens are having with their families, as Susanna just referenced, that relates also now to the COVID-19 vaccine.
Yeah, and I'll say that, Susanna and I certainly think that the best option here is for families to have informed, thoughtful decisions about all sorts of topics, including all the ones that we've been talking about. But it does put in the circumstances where there is some disagreement between the parents and the child, and the adolescent in this case has a whole set of reasons that they're interested in getting vaccination. As you know, I'm sure adolescents have really borne the brunt of some of the implications of COVID in terms of, in and out of school, not being able to go out with peers, meet with peers. So we think there is some value in cases where there is disagreement that adolescents do have the opportunity to self-consent because it has implications. COVID has implications both for their own personal health as well as their engagement with others in their community.
Susanna, when we look at how opinions may have changed, or at least the conversation that's happening in different states, even before the pandemic, when we look at some of the states that do permit minors to make vaccine decisions without parental consent, can you talk more about those states, also the District of Columbia, DC, about how they were able to come to this particular law?
Yeah, that's a good question. And one thing that Holly mentioned earlier, that different states have different rules about consent. It's the same for this. So 9 states and the District of Columbia currently have some kind of exceptions that allow at least some minors to self-consent to COVID vaccines. But there are all sorts of different ways that can happen. Some states, like South Carolina, for example, allows minors to make a lot of medical decisions when they reach the age of 16. Some states, there are 2 states, I think Oregon is one of them, that doesn't actually have an age for minor self-consent in general at all. There isn't an age threshold. Some states, or state-like entities like the District of Columbia, just have very low age thresholds. And then some other states have specific exemptions, in addition to mental health, substance abuse, STIs, things like that, also allow exceptions for communicable diseases and reportable diseases. So COVID-19 fits in that category. And then further complicated things, even some jurisdictions that are smaller than states can have exceptions to allow minors to self-consent to COVID-19 vaccines. So San Francisco, for example, passed a law allowing minors as young as 12 to consent to their own vaccines, even though that's not a statewide regulation. So no one quick answer, but really a whole variety of ways that states get to the end result of allowing minors to self-consent.
And Holly, with the example of San Francisco that Susanna just mentioned, what were some of the factors that led to this municipality to come up with this regulation? Do we know?
So I don't have information on that, but I can imagine, given what I was saying before, that I assume it was the city council perhaps that passed the rule, that they were looking at the well-being of their adolescent population, and given the justification that parents have in terms of making decisions on behalf of their adolescents, they decided that just because they don't want them to have vaccinations is appropriate reason for denying self-consent. So another way to say that would be that given the benefits to the adolescents, the potential risks of vaccination, that this should be considered routine. And if someone over the age of 12 was interested in seeking vaccination, there shouldn't be any barriers to their seeking that vaccine.
You're hearing Dr. Holly Taylor here on Where We Live, a member of the faculty of the Department of Bioethics, the Clinical Center at the National Institutes of Health. Her colleague here, also a fellow, Susanna McGrew, both publishing a paper in the New England Journal of Medicine recently titled Adolescents, Parents, and COVID-19 Vaccination, Who Should Decide? We'd love to hear the kinds of conversations you're having as a family. 888-720-9677, conversations about the COVID-19 vaccine. Holly, when we look at parental consent, is this something also in states that both parents need to consent?
Yeah, really good question. The way that most of these statutes are written, it says parental consent. And so the norm would be that in a two-parent family, either parent could consent. In families where there's a divorce or multiple parents, there may be some agreement across those parents as to who is the parent, but generally it's just one parent needs to provide consent. But you can imagine that on one hand, there might be parents that don't agree in a family, or you have a single parent and another parent in conflict. So that makes the ability of the adolescent to make their own decision complicated if the requirement is that a parent needs to provide consent.
To further show that this is complicated, a listener reached out to me, wanted to share that this conversation has been very difficult within her family because she's currently going through a divorce, and now her soon-to-be ex-husband does not want their children to get the COVID vaccine. And she says her children want to get vaccinated, but her lawyer has advised them not advised her to not take them to get vaccinated against her husband's wishes until a judge can decide. How do you respond to that, Holly?
Well, right, as you say, it's a good, though unfortunate, example of how complicated this can be. And I'll just say that, generally when we think about childhood vaccination, it's something that happens well before a child is an adolescent and is usually required before a child enrolls in school. So another way to say this is that routine childhood immunization is less complicated in the sense that there are, if you don't get your child vaccinated, they can't take advantage of public school. In this case, there's no state mandate or federal mandate for COVID vaccination prior to going back to school or entering school. So again, many layers of complication here.
Susanna, getting back to some of the conversations that teens may be having with a parent or parents, a lot on their plates, especially in the last 2 years, a lot of stress, a lot of anxiety. And so when we think about, the risks that teens face if they do get the vaccine without parental consent, it can really lead to some tense moments.
That's definitely true. And while Holly and I think that teens should be able to provide their own consent to COVID vaccines, that's definitely not to say that teens should just strike off from their parents and make their own decisions without consulting them. The ideal is that teens and parents talk together and come to the same page, even if they don't agree from the very beginning, or that they at least understand each other's positions. We view adolescent self-consent to COVID vaccines as kind of a best solution to a bad situation, the bad situation being some kind of conflict between parents and adolescents about these vaccines. But again, we think that there's clear and convincing evidence that COVID vaccines are good for just about all adolescents. And the best case is that teens realize that, parents realize that, and they jointly agree to get vaccinated.
We put out a question on our social media last week about this show and if what viewers and listeners should think about whether minors should be able to get this vaccine without parental consent. Anthony shared, agree, it should be as easy and over the counter as getting some vitamins at the drugstore. Goes on to say that he shouldn't allow some parents to make bad decisions for teens that already know better. Johnny shared, absolutely not, rather. And so it shows again that there's definitely a divide in how this topic and subject should be addressed within families. But Holly, before we go, I'm just wondering, this paper again published late last month. I'm just wondering, what has been the reaction to you and Susanna's research?
It's been positive, as well as the acknowledgement that we're not really talking about this age group in when we're talking about COVID vaccination, that there are really important things to consider when we're in the midst of a pandemic, where both individual and community-wide actions can protect ourselves, our families, our communities, etc. So positive and an acknowledgement that this is a group we should be talking about.
That's Dr. Holly Taylor again with the NIH's Department of Bioethics. Thank you so much, Holly, for your time today.
Thank you.
And also with us, Susanna McGrew, a fellow in that department. Susanna, thank you.
Thank you for having me.
You're listening to Where We Live on Connecticut Public Radio. Coming up next, how are pediatricians talking about the vaccine to adolescents and their parents? What conversations have you had about the COVID-19 vaccine in your home? Are you a vaccinated adult of a child who's eligible for the COVID vaccine but hasn't received it yet? Again, we'd love to hear from you. 888-720-9677. That's 888-720-WNPR. Share a comment on our Facebook page or find us on Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Some teens are working to help their peers find access to vaccines. Kelly Daniel Poor founded the organization VaxTeen after coming across a post on Reddit written by a teen whose parents were against vaccinations. The poster wanted to know how they could get vaccinated without parental consent. Here's Daniel Poor speaking on NPR station KCRW.
I think for a long time, the more present fear in our minds with vaccines was the supposed dangers they could have, and as really propagated by this anti-vaccine movement, versus we really weren't seeing epidemics and pandemics as often, and we didn't really understand what vaccines had been actively preventing for us. And so I think when we're having these conversations, trying to come from a place of understanding and mutual respect, and obviously having these conversations based in evidence and based in science, the best way to be productive is to know that you're trying to come to an ultimate resolution and come together. And there is something great about a young person who knows their parents and knows what works and their ability to use that and understand and emphasize.
We're talking about the conversations parents and teens are having about the COVID-19 vaccine. Most states, like Connecticut, do not allow minors to get a vaccine without parental consent. What conversations have you had in your family about COVID and the vaccine? You can join us, 888-720-9677. That's 888-720-WNPR. Or find us on Facebook and Twitter at Where We Live. Now, just like last week, the FDA approved the booster for 12 to 17-year-olds. Joining us now on Zoom is Dr. Sharon Ostfeld-Johns, Assistant Professor of Clinical Pediatrics and Internal Medicine at Yale. She sees patients at Yale New Haven Hospital in New Haven and at one of Yale's community hospital sites in New London. Sharon, welcome to the show.
Thanks so much for having me. Longtime listener.
Well, thank you for joining us today. We wanted to reference Kaiser Family Foundation's vaccine monitor poll that found that nearly, or rather 30% of parents surveyed would not allow their teens to be vaccinated. 18% said they would do it only if the school mandated it. I'm wondering if you can respond to that as a pediatrician.
Yeah, the information that we had from survey data leading up to the release of vaccinations for the pediatric population showed that about a third of parents would go out and get the vaccine for their children as soon as it was available. Another third would take a wait and see approach and see how other children responded and additional evidence. And that one third, as you mentioned, said that they would, under no circumstances, allow their children to receive the vaccine. So the numbers since vaccines have been released have fairly closely borne that out. And I think that that's a challenging one third of the population to continue to have conversations with, is the ones who, even before it was released, had made up their minds.
Can you tell us about some of the conversations that you have with your patients and their parents? You know, are you encountering parents who are hesitant about this particular vaccine, and why is that?
Yeah. So to be clear, I take care of patients in the hospital. So I'm often having conversations about vaccines at different times than with patients' primary care pediatricians. And we know from all of the evidence, including the Kaiser survey that you mentioned, that people really want to hear from their primary pediatricians. And so if people have specific questions about their individual case, I would advise everyone to speak with their personal pediatrician. The conversations that I'm having in the hospital often either revolve around a diagnosis of COVID in the hospital, or folks being in the hospital for another reason and me having a conversation with them about vaccination because it's so important, and because every time anyone interacts with the healthcare system right now, they should be having these conversations. Sometimes it's the first time they're able to speak with a medical professional, and so I'm often able to address concerns and questions. There's a lot of scary information available on the internet and other places that is not evidence-based, and so sometimes it's a relatively easy conversation to be able to answer concerns and questions.
When we think about those concerns and questions, I think you're referencing misinformation that is so readily available on social media. And so maybe tell us a little bit more about the kind of conversation you're having then with a particular patient or their caregiver in the hospital, if they raise a concern with you that they might recount something that they've heard about this vaccine.
Yeah, absolutely. I hear and, don't want to repeat some of the, the misinformation that's out there about vaccines. I think one of the points that I am frequently making about vaccines, regardless of the concern that's expressed, is that these vaccine decisions, whether it's an adolescent expressing that they wish to get vaccinated themselves, or an adult patient or the parents of a younger child, is that these decisions to get vaccinated should be some of the easiest medical decisions there are to make, because vaccines are some of the most highly studied medications that I offer ever. They're offered to such a large population that they must be safe. And so making those risk and benefit analyses, and as your previous guest talked about, who's able to make those calculations, whether you're 14 and you're able to weigh the risks and the benefits, or you're 18 and able to weigh the risks and the benefits. I would agree with them that because vaccines are determined to be safe for the general population before they are offered to such a large group, these are and should be relatively easy decisions.
And as you stated, the benefits of vaccinations vastly outweigh the small risk of adverse reactions. But, there were these reports earlier I guess last year rather, where, the CDC and others were investigating, very rare cases of potential heart conditions among young people who've gotten the vaccine. And so can you talk about that? And, while that was important to highlight last year, the findings today that can give people confidence that this vaccine is safe for their children.
Absolutely. So talking about myocarditis as a potential rare vaccine side effect, the first and most important thing to say is that myocarditis is a potential consequence of COVID that occurs at a much higher rate than with vaccination. We're currently in a state where there's 100% chance that you will be exposed to this virus. And if you are unprotected, the risk of having myocarditis, especially as a teenager, is many times higher than as a side effect of the vaccine. So that is one particular aspect that I have emphasized to patients who have concerns about this. The other is that the myocarditis associated with vaccines has almost universally been completely resolved afterwards and had no long-term effects for the children who have experienced it. At the beginning, we were quite concerned about those patients, often admitted them to the ICU for close monitoring, frequent laboratory tests, and ultrasound of the heart, and they have been followed up very closely. All of those children have done extremely well. And that can't be said of all of the children who have been in the ICU for COVID infection, unfortunately.
You're hearing on Zoom with us Dr. Sharon Ostfeld-Johns, Assistant Professor of Clinical Pediatrics and Internal Medicine at Yale, who also sees patients at Yale New Haven Hospital and also Lawrence and Memorial in New London, as we talk about vaccinations among minors, the laws in most states like Connecticut that require minors to get parental consent before they can get the COVID-19 vaccine. You can join us as well. We'd love to hear the conversations you've had or are still having about the vaccine in your family, particularly in relation to your children who are eligible for the vaccine. Our number 888-720-9677, or find us on Facebook and Twitter at Where We Live. When we look at the vaccine rate among children in Connecticut, doing better than the national average, Sharon?
Yes, absolutely. In general, our state has done better than the national average in terms of vaccinations. So for our youngest patients who have become eligible for the vaccine, the 5 to 11 range, we're getting close to 30% who have at least received a first dose. In the 12 to 17 range, we have about 75% who have received a first dose and getting close to 70% who are fully, or at this point, they've received 2 doses. We're, you hear me catching myself when I say fully. We will very soon be calling fully vaccinated 3 doses. I think we're getting away from calling them boosters because we know that there are just additional doses that are needed in this vaccine series in order to provide optimal protection.
And getting back to the questions and the conversations that teens may be having with their parent or parents about this vaccine, have you encountered families with different views on vaccines? And you tell us a little bit about how those conversations went.
So, absolutely. I think one thing that I'll emphasize, and from my perspective, as someone taking care of adults and children, is that the conversations that adolescents and their families are having are not all that different from conversations that other family members are having. I've taken care of, say, one spouse who's hospitalized who said to me, well, I I didn't get vaccinated because when I talked to my partner about it, we sort of decided that wasn't the best decision for us. And then I'll have a conversation with the spouse, and the spouse says, well, we each made our independent decisions and it was up to them. And so I think that the decision to get vaccinated, whether you're an adolescent or an adult, is very much dependent on the family situation and community around you and all of the different messages that you're getting socially, as well as from medical professionals. And so none of these decisions are made in isolation. I have encountered families where there's been discord. Usually one parent has expressed more concerns than another. And sometimes in those cases, the vaccination proceeds. Sometimes they proceed with one dose and decide to see how things go. And sometimes the objections of that one family member are so strong that they decide it's not possible. I've also heard of patients who have adult patients who have chosen to get vaccinated and hidden that information from other family members. And I think that's the type of situation that your previous guests were talking about, where, you know, there may be a small number of adolescents out there who, even against the strong objections of their parents, may choose to get vaccinated. I would emphasize that I think it's a small number who would actually proceed with that decision against the strong objections of their family members. And I think the answer to all of this, as your previous guest also highlighted, is just having more conversations and trying to engage more with medical professionals who are trusted and both teens and parents trust to have these conversations with.
In our state, would you like to see children be able to make their own decisions about vaccines, Sharon?
While I'm not a psychologist, I think the evidence that your guests previously cited about 14 and older having the capacity to make risk and benefit decisions, I think that that would be very reasonable. And I think that including communicable diseases in sort of that general bucket of things teens are able to decide independently about would be appropriate.
We heard from a listener in Farmington who wanted to share her review on this. She said to our call screener, kids aren't allowed to vote for a reason. Their brains haven't developed. Vaccines allow certain freedoms, but research also shows side effects. And so how would you respond to that, Sharon, as a medical doctor?
Yeah, I would say that the ideal situation is that adults are involved and informing teens about these decisions. But I would emphasize again what I perceive to be the ease of decision making around vaccines that are recommended for the general population. We can only do that safely as a medical community when we know that things are appropriate for an easy decision to be made by the general public.
You mentioned that you treat patients within hospitals. We're in this Omicron surge right now. When we talk about the importance, the urgency of getting vaccinated, some may point to what's been reported that children may not experience as severe complications as an adult to COVID-19. But how, as a medical professional, how do you want to address that? Because it seems that sometimes people will point to that as, my child doesn't need to be vaccinated because if they get sick, it's not going to be severe.
So there are a number of things I would say about that. Number one, no children should be put at risk for having an illness that has a relative risk of hospitalization as COVID does. We are seeing higher numbers of pediatric hospitalizations in this wave with this variant. Whether that's because the denominator is bigger because we're having such a large number of infections, or because this variant is more able to cause that moderately severe version of illness requiring hospital stay, but we're not seeing a significant uptick in ICU cases for pediatric patients. I don't know whether that's the case. What I will say is there are a number of other reasons why vaccination is important from a social and public health perspective for each individual teenager. Number one is the ability to stay in school. So people have talked about the effect of this pandemic on children. One of the major effects has been limiting their ability to be in in-person school. With the current public health guidelines, if your child is vaccinated and has even reaching the point where an entire classroom is quarantined, the children who are vaccinated will be able to stay in school under our current guidance. And this, as a mother of a public school student, was able to benefit from this. My son is vaccinated and he was able to stay in school even though there were positive cases in his classroom to the level where most of the class had to be quarantined. So that's a significant benefit that may be a stronger benefit for the adolescent themselves than their parents. Additionally, from a mental health perspective, the idea for a child that they would be able to transmit the virus to vulnerable people either within their household, their loved ones, or their classmates at school, or teachers or faculty or staff, that burden from a mental health perspective, I think, is really significant and needs to be considered.
I wanted to fit a quick call from a listener. Julie in Monroe's calling in. What did you want to share, Julie?
Hi, good morning. I'm a parent of a 13-year-old, soon to be 15-year-old. They both got their boosters over the weekend, so we're very grateful for that. And one of my biggest concerns is actually the pediatrician who we are leaving because he is spreading COVID misinformation. He's refusing to vaccinate his patients. He himself is not vaccinated. He asked people to take off masks while in the office. And so I am going through the appropriate process with the state to try to report him. But it is very difficult to actually do that. I can't get a hold of anyone to speak to. And then if the state website's up to date, his license is also expired. And I'm just wondering, hey, can you help me out here? How can I do this quicker? Because I'm a scientist. So when he gave me that information and tried to talk me out of my first vaccine, which he's not my doctor, he absolutely should never have spoken to me in those terms. I, fact checked him in real time. I worked very closely with researchers at Yale Med. I'm going to Yale this morning, actually, to work with them. So I just get concerned. Yes, people want to reach out to their pediatrician for best advice, but what if a pediatrician is flat out lying and has gone down a hole that you've never expected? And there's a lot of folks who don't have my training who are following his guidance. It's scary.
Sharon, how did you want to respond to Julie? That is alarming what she just shared.
Yes, Julie, I absolutely do find that very alarming. What I think I'm happy to say is that I think that's very much outside the norm. The available evidence in surveys of physicians receiving the vaccine and I would think conveying appropriate information about it is that 96% of practicing physicians have been vaccinated, and that was as of essentially last year at this time when we were first able to get vaccinated. The fact that the license is expired is also very concerning. And in terms of specific guidance of how to go about reporting this individual, I don't have that information. I can potentially try to find it and we could be in contact, but I really appreciate you trying to go through those channels to limit this individual's impact in spreading misinformation to other patients.
And Julie, we'll be sure to follow up with you after the show. We'll also take down your information, but thank you for calling. I want to thank Dr. Sharon Ostfeld-Johns, who's been here with us, Assistant Professor of Clinical Pediatrics and Internal Medicine at Yale. Thank you for your perspective today.
Thank you so much for having me.
This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Coming up, we hear from a hospital system that's worked with teens to become COVID-19 ambassadors. You're listening to Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. We've been talking about the conversations teens and parents are having about the COVID-19 vaccine. But what conversations are teens having with each other about the shots? And how can these conversations between peers help address vaccine hesitancy? Joining us now is a doctor at Stamford Health about a program they initiated to have teens become COVID-19 vaccine ambassadors. Dr. Asha Shah is Director of Infectious Diseases at Stamford Health and is also the hospital epidemiologist. Dr. Shah, welcome to the show.
Thank you so much for having me.
So tell us about this hosting high school students and how you got involved with the ambassador program.
Sure. So I have played a role in our local public schools health and safety task force in terms of safe practices about COVID, reopening schools. And so being in conversation with some of the school nurses and, some of the superintendent, et cetera, we started to have conversations about vaccine hesitancy amongst adolescents. And these conversations really started last spring and summer when the new age groups kind of became more eligible for vaccination. And while Connecticut does have a very high percentage of vaccinated individuals, there are still those, of course, who are vaccine hesitant. So we kind of put our heads together to figure out how to address vaccine hesitancy in a different way, because there's so much out there about, webinars and information from the local Department of Health and parent Zooms for schools and, trying to get the information out to parents. But what kind of information is targeting children and targeting adolescents and making sure that their specific questions and concerns are being answered? And so we kind of came up with this strategy of bringing the students to us, instead of us going to the school and saying, hi, I'm Dr. So-and-so, I have no relationship with you. Why would you listen to me about vaccines? Instead, we said, let's open our doors. Let's identify these high schoolers.
Dr. Shah, can you hear us?
To a patient who has COVID, and what do their lungs look like on chest x-rays, and how do we care for them in the ICU? What kind of personal protective equipment do we wear to take care of them? And kind of show them the flip side, that if you don't get vaccinated, what are the consequences? And we thought this was effective because then they could go to their peers and have conversations with them to say, hey, like, this is real, this is serious, and this is how you would protect yourself.
Dr. Shah, your Zoom had broken up a little bit. Just wanted to recap. So there were a group of 10 to 15 students that came into the hospital, and you explained, and they were able to see kind of firsthand some of the work that's being done as your professional at Stamford Health are treating patients. Is that right?
Yeah, so we created 3 different stations for them, and we actually had our medical residents, who are young physicians, run the stations. So we tried to connect a younger generation of doctors with these high schoolers. So we showed them how to put on the personal protective equipment that you would wear to go take care of a COVID patient. And the thing I remember the most is when they put on that N95 their eyes kind of lit up. They're like, wow, like this is a serious mask, and I explained to them, that's what you need when a patient has COVID. And a lot of them took them home as souvenirs. They were so fascinated by them. We had another station where our pulmonologists looked at chest x-rays and CAT scans of patients' lungs with COVID. And we said, this is what it looks like for a patient who gets COVID, and this is what happens to their lungs. And then the last station was we showed them, we set up the room like an ICU room, and we had a mannequin in the room. And we showed them the process that we use to flip patients on their stomachs, because part of the management of patients with severe COVID-19 is to flip them on their stomachs. It's called proning, and that improves the lung dynamics. And so we showed them how that process happens with the ICU team. And so it was just like very specific aspects about COVID care to teach them a little bit about what we do in the hospital to take care of these patients.
We just have about 3 minutes left, but again, this group of teens, they weren't vaccine hesitant, but they're able to go into their classrooms, their social circles, and talk about what they observed to help maybe combat some of that misinformation out there, Dr. Shah?
Yeah, that was the intent. The intent was to create a relationship with them, mainly between our medical residents and the high schoolers, so that we arm them with the right information to spread to their peers, because you are correct. None of them were vaccine hesitant. In fact, they were required to be vaccinated to partake in the program. But they have now been able to create informational flyers based on the information that they received to spread around their peers. They were talking about doing a health fair, and we're continuing the relationship with them. Thinking about going to sporting events, for example, and setting up a table to answer questions for parents and for children and adolescents.
That's good that you've made those inroads. And as a member of the Stamford Public School Health Task Force, since inviting the teens in, do you have anecdotes from them? Have they had situations where they've shared what they've learned with peers who might be vaccine hesitant?
One particular story was really memorable, is that one of the students shared her experience with her friend who was vaccine hesitant, and that friend actually ended up getting vaccinated. So it's the one instance that I knew that, the information was shared, and in a positive way, it encouraged one of the other students to get vaccinated.
Well, this has been an interesting, it sounds like it's an interesting program that is continuing the efforts by Stamford Health. Dr. Asha Shah, again, is Director of Infectious Diseases, also the hospital epidemiologist. Thank you for coming on to talk about what you're doing among teens in your community.
Thank you.
I'm Lucy Nalpathanchel. Tess Terrible produced today's show. Kat Pastor is our technical director. We'll be back tomorrow.